Last night, a major update landed that's got parents, doctors, and the internet racing to search Tylenol and autism, and the headlines are loud. Federal health officials are flagging a possible link, and the FDA has begun steps to notify physicians and review acetaminophen safety labeling. If you're worried, sit tight. I'll walk you through what officials said, what the science actually shows, and what experts are telling families right now. U.S. Food and Drug Administration. +1. Quick heads up before we start, I'm not a doctor. This video explains the news and the science so you can understand the headlines, but if you have a personal medical concern, talk directly with your healthcare provider. Acetaminophen, brand names like Tylenol, is one of the most common medicines in American homes. Pregnant people use it for fever and pain because, historically, guidelines have recommended it as a safer option than many alternatives. That's why any talk about risks immediately raises big questions. How often was it used? Who's actually affected? And does a report mean moms should stop using it? U.S. Food and Drug Administration. Here's the science in a nutshell. There are several studies that find a small statistical association between prenatal acetaminophen exposure and a slightly higher rate of neurodevelopmental diagnoses, including autism and ADHD, while other studies, using different methods, find no effect. Two recent pieces of work highlight both sides: a large Mount Sinai analysis that supports an association and a sibling control study in JAMA that found no link once family factors were considered. That mixed picture is exactly why experts urge caution before drawing hard conclusions. Mount Sinai Health System. +1. So what did officials actually announce? Health officials, including HHS and FDA representatives, said they will start notifying clinicians and begin the process of reviewing acetaminophen labeling to make sure doctors and patients get clearer guidance. And they also discussed research priorities and possible public messaging. Those announcements are what pushed this topic into the top searches this hour. HHS.gov. +1. You're probably asking, does that mean acetaminophen causes autism? Short answer: the evidence is mixed and does not prove causation. Observational studies can show correlations, small differences in rates, but they can't on their own prove a direct cause and effect. Scientists point to confounding factors, dosage patterns, and the challenge of separating medication effects from the underlying reasons people took the medicine, like fever or infection. That's why regulators are calling for more study, not a blanket ban. Mount Sinai Health System. +1. And yes, there's a legal and public side to this, too. Lawsuits and advocacy groups have been active for months, and a big government statement ramps up attention. Parents see headlines and worry about kids already born, expect more media coverage, more lawyers posting claims, and more experts being quoted on TV. That media swirl is part of why searches spiked so fast. We'll keep this factual and not dive into legal advice here. AP News. If you're a parent watching this, what should you actually do right now? Don't panic, and don't stop or start medications without medical advice. Practical steps people are being advised to take: check with your obstetrician or pediatrician if you're currently pregnant or planning to be, follow official guidance from agencies like the FDA, and keep an eye on reputable medical sources as the review unfolds. Those are the safe moves while science catches up. U.S. Food and Drug Administration. Why does this story matter beyond headlines? Because medicines, policy, and public trust intersect here. If labeling changes or clearer guidance come out, it could change how clinicians counsel patients and how families make decisions. It could also shift research funding and clinical practice, and that's a ripple effect, not an overnight switch. What part of this update worries you most, the science, the politics, or the personal impact? Drop that in the comments, I'll read them. Let me close with this: news like this can feel scary because it gets personal fast, but it also shows the system working. Studies are examined, regulators are asking questions, and the debate is public. We'll be tracking the FDA's label review, new research, and expert guidance as it arrives, so if you want calm, fact-based updates, not hot takes, subscribe and hit the bell. History is being rewritten in the headlines right now. Let's follow it together, the careful way. Disclaimer. This video is for informational purposes only and should not be taken as medical advice. Always consult your healthcare provider for guidance.